To London, Boris Johnson will today set out plans for a strengthened three-tier system of coronavirus restrictions to replace the national lockdown in England and pave the way for a limited relaxation at Christmas. The British Prime Minister is expected to offer a proposal to deploy a major testing scheme, also in an attempt to win over rebels on the Conservative backbenches. Correspondent Olly Barratt, good afternoon to you and welcome. I'm reading about a strengthened three-tier system of coronavirus restrictions that will replace the national lockdown. How would that work?
That's exactly right, Jeremy. Good afternoon. And the tiered system that we had in place before England went into its current national lockdown is considered not to have been quite strong enough to get some of the real hotspots in the country under control in terms of infection rates. So as England comes out of the national lockdown, which ends on December the 2nd, from December the 3rd, those tiers will be reimposed based on how large regional outbreaks are, but they will indeed be strengthened. In the toughest tier, for example, it may be that pubs and restaurants are not allowed to reopen, can only continue to offer takeaway services. We do understand that gyms are going to be able to reopen in all of the tiers. Competitive sport for amateurs is going to be allowed to resume as well, but some pretty stringent measures remaining in place elsewhere. And then you mentioned that Christmas plan. That is yet to be agreed between the four nations of the United Kingdom, but the idea is that for 4 or 5 days over Christmas, measures will be relaxed so that 3 or 4 families can get together, or 3 or 4 households from one family can get together for a few days over the Christmas period. That is deeply controversial because the scientists advising the government say, look, it's all very well relaxing the measures for a few days over Christmas, but it might indeed mean that after Christmas you have to reimpose them in an even tougher way to make up for lost ground if infection rates rise as a result.
And there are still shortfalls when it comes to testing, and that has caused a great deal of anger from within the PM's own party.
Yes, the testing issue is really not so much about a shortfall in terms of the amount of tests being done, because that is a vast number and, according to the government, the biggest by some distance for any European country. The issues around testing have often been about people getting their results on time, about them then isolating when they should be, whether enough contacts are being traced of people who do test positive. So what the government is rolling out now is mass testing for those areas of the country that are going to be in the highest tier. The idea being that you can say to people who do enter the toughest restrictions after national lockdown that there is a way out. So mass testing will be offered for entire towns and cities so that you can track down exactly where the virus is and try and get on top of it and try and offer areas a way back into tier 2, maybe even tier 1 at a later date. But certainly huge concern about whether that is a realistic proposition, whether some of the problems that we've seen in the test and trace programme so far will continue or not. And you're quite right that there are many MPs in Boris Johnson's own Conservative Party who think that it's just not right to have large swathes of the country in what they see as lockdown in all but name.
And with increasing momentum, we're starting to get more and more news about COVID vaccines, this time from Oxford University. What's the efficacy there?
Yes, well, the headline figure is perhaps a bit misleading. Oxford saying that overall it's 70% effective, its vaccine, but that is looking at a couple of different ways of dosing it. And one particular way of dealing with this, that they say you can give patients half a dose at first and then a full dose a few weeks later. And under that regime, that comes out at an efficacy rate of 90%. So now regulators here in the UK are going to look at whether that type of dosing can be rolled out, whether it's safe, and if possible, if it is able to be approved, then that would mean that this is a vaccine that is 90% effective. That would also mean, because you're only giving half a dose the first time round, that actually the doses that various countries have bought in advance would actually go further in terms of the amount of people that they'd be able to vaccinate with those doses. The UK has already bought 100 million doses, so if you were to look at doing 2 doses per patient, of course that only vaccinates 50 million people. But if you are giving half a dose the first time around, you could vaccinate the entire UK population with that number. Crucially also, this is much cheaper than the other vaccines that are already showing promising signs pipelines like Pfizer and Moderna. It's much easier to store, much easier to distribute, and Oxford AstraZeneca have also committed to making it available at cost for developing countries. So in many ways, despite the slightly lower headline number in terms of the efficacy of the Oxford AstraZeneca vaccine, the results that we've had today may well be the best so far in terms of the potential impact on the outbreak worldwide, and how quickly the population of the world could be vaccinated with this vaccine and others.
Olly Barratt is our correspondent in London. Now